Hello, everyone. We are a group of five people from CSR NCL, and the topic of our societal awareness program presentation is face mask, hygiene, safe disposal, and environmental impact. Our group members are Chandan, Geeta, Neha, myself, and Swati. The motivation for carrying out this work is that the world pandemic called for face masks to be used on a daily basis, and now they are the new normal. This strict usage called for extreme reuse and disposal techniques. World Health Organization and Centers for Disease Control and Prevention are the main agencies that make guidelines for usage and disposal of face masks. However, these regulations are useful to set international laws and rules, but its implementation and disposal is varied in each country. Hence, we need to strictly analyze the current situation of face mask distribution and disposal, especially in India, which has the highest population in the world, and find viability of its reusability. Objectives of this work are as follows. We have made the general public aware about the proper usage, types of face masks, disposal methods at personal and government levels through a general survey for all age groups. Secondly, we have identified groups working towards the disposal, collection, and recycling of non biodegradable masks to make useful products for the community. Thirdly, we have pinpointed the shortcomings in segregation and recycling processes in India and Maharashtra, and generally speaking, in Pune. To find out, we have also found out new workable solutions at lab scale to bring to life the concept of best out of waste and analyze the scale up budgeting. A brief history of face mask. In the 13th century, silk scarves were used as a face mask the breath to prevent breath from affecting the food that was being prepared. In the 16th century, the most famous beak masks were invented, which were greatly used for preventing the widespread of Great Plague in the city of London. Dr. Wu Lin Di from the Chinese dynasty invented the basic prototype of the modern surgical face mask, which was made of two layers of gauze, and it was then called Wu's mask. Recently, the most common and recently introduced mask is Guardian G Volt face mask, which exploits antimicrobial properties of graphene and electric charge to repel and deactivate microorganisms coming in contact and provide sterilization and reuse potential. Guidelines for wearing face masks. Guidelines are set by WHO and CDC, as I have mentioned earlier. WHO clearly states in its do's that we need to wash our hands before wearing face mask and also after removing the face mask. The face mask should be held by its strings only, and the cloth should not be touched from the center. It should cover the nose and mouth properly. Don'ts include: we should not touch the mask in the center of the mask while wearing. The mask should not be pulled down below the nose, and it should be disposed of properly. Guidelines by CDC. CDC has set similar guidelines, which includes the mask should have two or more layers of washable, breathable fabric. It should completely cover nose and mouth. It should fit snugly against sides of face and do not have any gaps. And the don'ts include: the fabric should be breathable, that is, it should not be non-breathable. For example, vinyl should not be used for making a face mask. It should not have any valves or vents which will allow the virus particles to escape. And the most important one for all of us is that the masks that are intended for healthcare workers, that is N95 or surgical masks, should not be used by common people on daily basis. These are the types of masks. The first types are reusable, biodegradable, eco-friendly masks. The second type includes few time usable, non-biodegradable, and these masks are hence polluting. Figure 1 to 12 show the different type of masks that are commonly used from day to day life. Components of non-biodegradable surgical face masks include: the outer layer is made of spun-bounded non-woven polypropylene. It is waterproof bacteriostatic layer. The middle layer is the most important filtration layer, which is made of polypropylene melt-blown superfine fiber layer. Inner layer is made of non-woven fabric, It is water absorbing and skin friendly layer. The middle layer is the one that is non biodegradable and leads to waste and earth pollution. Biomedical waste management. This slide shows how the waste is segregated in hospital, in common medical facilities, including hospitals. The green dustbin is used for general waste, that is the household common waste, such as kitchen waste, paper, and tissue waste. The red dustbin is used for disposing used syringes, gloves, and plastic waste. The yellow dustbin is used for soiled, chemical, liquid, and laboratory waste. The blue dustbin is used for glasswares, used glasswares, broken glass waste that we see in our labs. The blue dustbins are very common, and gray dustbins are used for disposing sharp things, including needles and cut glasses. So the key points are that the red and yellow dustbins are used for viral infected PP waste disposal. Yellow bins should be installed at all the public spots for easy usage and reusability. This is a poster published by the Central Pollution Control Board of India, which shows that how the red, yellow, and blue and grey dustbins should be used in an ICU or any emergency or healthcare center. The red dustbins are used for disposing syringes, IV sets, PPE kits, goggles, face shields, splash proof apron, etc. The yellow dustbins are used for disposing shoe covers, disposable gowns, non plastic and semi plastic coveralls. The blue dustbin, as I have mentioned earlier, is used for disposing glass and metal wastes. The grey dustbin is again used for disposing sharp and pointed things. Next topic will be presented by my colleagues, Mrs. Swati. Thank you.